Hello and welcome to this episode of On Geriatrics. Today we shall be talking about the role of diet and dietitians in geriatric care. Diet is a very complicated and complex topic and there are a lot of controversies. I will not get into all of that. What I shall try to do today is to outline the components of a normal diet and what essentially would be the framework for a healthy diet which will help us to age gracefully. Each individual, depending on his choices as well as his medical condition, can build around this framework to adopt a diet which is most suitable to that person. What we will attempt to do is to understand the framework of diet and what a healthy diet ought to be. As you all know, diet has many components. So these components are the macronutrients which provide us with calories, the micronutrients, roughage, and water. The macronutrients are the carbohydrates, proteins, fats, and alcohol. The micronutrients are the minerals and the vitamins. Roughage, as you know, are those undigested portions of the food that we eat, which helps us to form the stools, which is then evacuated. Water, of course, is a lifeline for all of us. All living beings require water. And the only question is how much of water one needs to take. What are the carbohydrates? The main carbohydrates in our diet are the sugar and jaggery, which are refined carbohydrates. Then there are the bulk carbohydrates like rice, wheat, and in some instances corn, millet, etc. Tubers such as potatoes, yam, tapioca are also a major source of carbohydrates. Then let us go on to proteins. Proteins, there are both animal sources as well as plant sources. The animal sources are the egg white, chicken, fish, all meats, including red meat such as beef and mutton, and seafood, etc. Milk is another important source of protein. Among the vegetable sources are the pulses, legumes, beans, grams, etc. Of course, there is some amount of protein even in the cereals such as rice and wheat, but that's comparatively less. Moving on to fats. Fats are of two main types. One is the oil and the other is cholesterol. Cholesterol, the only source is animal food. And these would include milk, especially the cream of the milk, the egg yolk, red meat, especially beef and mutton, and of course, to some extent, in other animal foods as well, such as seafood. The other source of fat are the oils that we consume, which are mostly obtained from vegetable sources like coconut oil, palm oil, and from various other nuts, etc. These oils are further subclassified as polyunsaturated, monounsaturated, and saturated. The first two are comparatively healthy. One should avoid saturated fats. And one should also avoid trans fats. The main source of fiber in our diet would be from fruits and vegetables and also from pulses, legumes, etc., especially those which have skin on them, like green gram, for example. Moving on to water, the tricky question is how much water to drink. There is a popular notion that one must drink as much water as possible, but this is not true. Drinking too much of water can sometimes overwhelm the kidney and produce low sodium or hyponatremia, which as we age can be a big problem. So one should aim to optimize the water intake depending on what climatic conditions we live in, that is how much heat is there, how much we perspire and sweat, and also the degree of activity, because the more active you are, physically active you are, the more one would sweat. In a temperate temperature environment with moderate levels of activity, typically 1 to 1.5 liters of fluids suffices. But depending on activity and if there are other fluid losses, one should increase the intake to match the loss of fluids. It is important to remember that all fluids are for most part water and should be considered as such. Alcohol is a source of calories, which many of us are not aware of. In fact, a milligram of alcohol can produce or provide up to 7 calories, which is more than what starch provides. So, drinking can lead to intake of empty calories, which can help us put on weight. So, it is important to realize this, and definitely one should not think of using alcohol as a source of calories for obvious reasons. Vitamins and minerals, the main source would be vegetables and fruits, but it is important to remember that these are present in animal sources as well as in cereals to some extent. Vitamin D, as you know, apart from milk being a good source, can also be obtained from sunlight, where adequate exposure is needed to sunlight. So what is the framework for a healthy diet? It is actually quite simple. Reduce starch or carbohydrates and fats as much as is possible and increase proteins. Take adequate fruits and vegetables and optimum level of water. In a nutshell, that is a healthy diet. So, in a country like India, where we eat a lot of rice and wheat, try to reduce the quantity of rice and wheat that we eat and instead substitute that with more protein-rich food like pulses and legumes, as well as non-vegetarian food like fish or egg whites, etc. Take plenty of vegetables. Take adequate amount of fruits as is permitted by your medical condition. So what does the dietitian do? The dietitian interacts closely with the patient and the patient's caregivers to determine the patient's choices with regard to the kind of food that he or she likes. And then she advises diet which is practical for the patient and the caregivers to give. It's very easy to just give out a long diet chart, but if the patient is unable to follow it, then it's of no use. So it's important that the dietitian spends a lot of time with the patient and caregivers and tailors the diet according to the patient's condition, the medical condition, as well as the palatability and his or her preferences. This is why the dietitian is a very, very important person in geriatric care. With this, I end this episode. In the coming episode, I shall be talking about the role of the medical social worker in geriatric care. Till then, goodbye.